Thank you very much, Mr. Chairman, ladies and gentlemen. I want to start by thanking the organizers of the meeting for extending this invitation to me. I'm very pleased to be here today. My contribution today is about obstetric gynecology in Egypt, the training, accreditation exams, and challenges as seen. This is the layout of the talk. And let me start by saying something about the history of medical training in Egypt. Because medical education in Egypt is very ancient. It started even 3,000 years before BC, and as you remember, there was the old university at On here at Ain Shams, on the city of the sun, called by the Greeks Heliopolis. The importance of, as you can see, the medical instruments, the importance of medical chair, something we're coming back to today. Following this, the old Alexandria Medical School started in 332 after the establishment of the Hellenistic empire of Alexander the Great in Alexandria. And this is Soranus, who has this first book on gynecology, called Gynecology actually, and he was the first person to describe the uterus. This was followed by the medieval times, and actually in Egypt, during medieval times, there was still medical training. This is the Al-Mansur Qalawun complex in Cairo, including the hospital, which is still working until now. And this is Maimonides, Musa ibn Maimun, the Grand Rabbi, but also the physician of Salahuddin Ayyubi, who was born in Cordoba but practiced and died in Egypt and Cairo, and he's actually buried in Cairo. But modern medical education in Egypt started with Muhammad Ali Pasha, the founder of modern Egypt, who in 1927 decided to establish a medical school at Abu Zabal at that time, which was 10 years later moved to the palace of Mr. Aini called Qasr al-Aini. And of course, today, Qasr al-Aini Hospital is located in this beautiful modern complex. The first department of obstetric and gynecology started in 1929 with the father of obstetric and gynecology in Egypt, Professor Naguib Mahfouz Pasha, who was established the first antenatal clinic in Qasr al-Aini in 1919 and became the first professor in 1929, seen here being given the honor by the honor of the Nile, actually, by Professor Nasser, and again being recognized by King Farouk. So between 1900 and 1970, there were only 4 medical schools, 300 graduates per school per year. The training opportunities were excellent, and there were local and international degrees. People would go for local degrees or international degrees. There were adequate hospital facilities. There was decent in-hospital accommodation for residents, a decent salary compatible with daily life. There was a possibility of private practice and increasing the income of doctors, so that some doctors became very affluent, actually, which produced some animosity among other staff of the community. And as you can see in this on the right side, the doctors were told that they had the 5 beautiful things in life: a beautiful bride, a beautiful car, a beautiful estate, a beautiful clinic, and a beautiful building. And again, immigration, therefore, was rare among physicians, particularly obstetric and gynecology specialists. And those who left Egypt and practiced abroad presented a high standard, which was shown in wherever they worked in the West, either in North America or in Europe. As I said, the Cairo Medical School started in 1827. It was incorporated in Cairo University in 1908. The second medical school was established in Alexandria in 1942, then Ain Shams 1947, Asyut 1960, and Mansoura and Tanta in 1962. And today we have 23 state medical schools. Al-Azhar University, of course, is a religious school, but in 1961 it was decided that it will also start teaching scientific subjects, including medicine. But for them, they separate boys from girls, and therefore they have now 6 medical schools, 2 in Cairo, 2 in Damietta, and 2 in Asyut. In 1996, private medical schools were started to be established, and now we have 11 of them, and maybe they are increasing by the year. And more recently, in 2013, military medical school was established. Therefore, the total today is about 41 medical schools in Egypt. Now, what is the number of physicians in Egypt? Well, the registered physician are about 232,000, 233,000, but actually those who are practicing are only 82%, representing about 1/3 of them. So many doctors who are actually registered with the syndic of doctors do not practice or are practicing outside of Egypt. And Egypt produces about 10,500 medical students, graduate admissions every year. Of them, about 9,000 are graduated every year. Therefore, based on these numbers, the number of physicians for every 1,000 citizens is 0.8 or 0.79, according to the latest statistics. It was more than this few years ago. And this is how it stands now in the MENA region. As you can see, in places like Qatar, it's 7.7 per 1,000 population. In Israel, 5.4, and Jordan, and so on. And as you can see, Egypt is one of the lowest because the WHO recommends that at least one doctor per 1,000 population, and the world average is 2.3. So what about training in obstetrics and gynecology in Egypt? Now, what happens today up until now is that the undergraduates undergo 6 years of medical education, then 1 year of house officer. After this, they can become university residents or residents in the MOH, Ministry of Health hospitals, or they can join any other medical facility which has no residency, or they can go abroad to do a residency, as you can see here. So those who stay in Egypt can go for a diploma for 1 year, or go for the master's degree for 2 years. And this is the majority of people do this. They join the master's degree for 2 years, and if they want, they can go for a doctorate degree for 3 years. Those who go abroad, of course, can go to Britain and get the MRCOG, or to France and get the DS, Diplôme Université de Spécialité, or Diplôme d'État de Spécialité, DES, or the American Board of the German Facharts. Now, training in Egypt, unfortunately, in recent years, leaves much to be desired. It is not standardized, so it varies between hospitals. A young doctor can be lucky and go to a hospital, a university hospital, where training is very organized, and sometimes in different other places which is where it's not organized. The numbers can be large numbers, therefore giving smaller opportunities for training. And the training actually is controlled by the universities, where the system of having a supervisor per candidate does not exist like it is in the United Kingdom, for example. And there is little attention to logbooks. In some hospitals you find the logbooks, and which are enforced, and sometimes they are completely absent. There are poor in-hospital accommodations for residents in most of the hospitals, and therefore there are inadequate training opportunities and facilities. And as said, this training is controlled by universities, and the university is controlled by the Supreme Council of Universities, which controls the training degrees. Although they are not theoretic degrees, they are vocational degrees. However, they are controlled by the Supreme Council of University. This is, again, something that needs to be addressed, because there is no national body controlling the training, like the Royal College in England or the American Board in the United States and so on. And therefore, accreditation of specialists and consultants is based on theoretical degrees, not on substantiated training. So you become consultant if you have a certain degree, not because you've had some training. You're supposed to have had training, but there's no control of this training. Therefore, the result is that the variable standards of trained doctors. Some doctors are very well trained, some are not very well trained, although they carry the same degree and they are appointed to the same position. Subspecialization is not regulated so far. Accredited specialists sometimes are incapable of performing some interventions. For example, they may not be doing forceps at all, or vaginal abnormal vaginal deliveries, for example, and they who can only do cesarean sections. Substandard doctors can still practice in the private sector, where therefore you can end up by complications, and of course, all this can, on the long run, mean loss of confidence in the Egyptian degrees, particularly if medical doctors, these young medical doctors, go outside of Egypt to practice. Now, what about the exams? Maybe the exams are the best things which are still properly organized. Now, this is the slide we showed before. The undergraduate 6 years, then 1 year of house officer, and so on. So people go for the degrees. As you can see, they can vote for diploma for 1 year, or a master degree for 2 years, or a doctor degree after that for 3 years, which is a minimum, takes a minimum of 2 years, and the master takes a minimum of 2 years, and the diploma a minimum of 1 year. So, however, there are now competing degrees. There is the Egyptian fellowship, which the Minister of Health tried to introduce recently, or many years ago actually, and it has been working for some time, and then it has been opposed by the universities. The universities wanted to control the whole training and the whole accreditation, so this continues up till now. And more recently, an Egyptian board was established, a new degree called the Egyptian Board of Obstetrics and Gynaecology. There are some doctors who go for the Arab Board of Obstetrics and Gynaecology, some who would like to travel to Arab countries, for example. And then, of course, we have the foreign degrees, the British MSOG, the French DES or DES, the German Facharzt degree, and the American board for those who travel. But as said, the medical exams, which are done in Egypt, are up to now more or less properly controlled. As you can see, these are the master degrees or the doctor degrees, and the board and the fellowships again. The master degrees are individually organized by the medical school. Each medical school organizes its master degrees and its doctor degrees and so on. So there is no uniform exam, for example, for all of these. While the Egyptian board and the Egyptian fellowship are centrally controlled. And usually the exam consists of multiple choice questions, best single answer, clinical scenarios, as you can see in this picture. Although OSCE, the objective standardized clinical examinations, are also part of the exams. Sometimes the students are given assignments for which they have marks. There is little emphasis on viva or oral exams to minimize bias, at least in most of the places known to me, and occasionally some universities who have the facilities do the clinic exams on live patients. What about accreditation? Now, the hierarchy of medical accreditation is used in Egypt goes like this. When you qualify, you become a general practitioner, and after some time you may become assistant specialist, and then specialist, or specialist straight away, and then a consultant, and then we have the senior consultants, or consultants A, as called by the Minister of Health. And this is the way it goes. So if you look at the left, the general practitioner, after qualification from medical school, he may go for the diploma, and after the diploma he becomes assistant specialist, and after 3 years he can become specialist. Or he can go straight for a master degree, which usually takes him 3 years, and at the end, when he obtains the master degree, he automatically becomes a specialist. He can wait for 4 years and become a consultant, and then for another 5 years to become a senior consultant. Or he can go straight for a doctorate degree and then become a consultant, and after 5 years become a senior consultant. However, because of few training opportunities in Egypt, many people travel abroad. those who go for the MRCOG, they need to wait for 10 years to become consultants after the MRCOG, and then another 5 years to become senior consultants. Those who go for the FACHARTS or the ES or the ES, or those who hold the FRCOG need to wait 7 years to become consultants. And here is the problem, because apparently the authorities do not understand the difference between the Royal College of Surgeons and the Royal College of Obstetricians and Gynaecologists. As you may know, the Royal College of Surgeons have an MRCS and FRCS, and both degrees are based on exams. However, as we know, the MRCOG is based on exam, but the FRCOG is you become an FRCOG after 12 years of obtaining the MRCOG, and this is something that needs to be explained to the authorities in order to correct. That's because if you have the FRCOG, FACHARTS, or the DS or the ES, you have to wait 7 years to become a consultant. However, if you take the American board, you become consultant immediately. What the Egyptian authorities are trying to do now is to encourage people to go for the Egyptian board. So if you go for the Egyptian board, you wait only 4 years to become a consultant, and then for another 5 years to become a senior consultant. Therefore, by asking people to join the Egyptian board, people are going to go for the Egyptian board to cut short on their accreditation. But here's the problem. What the authorities are trying to do, instead of improving training standards for the Egyptian board, they are trying to belittle the standard of the international degrees. And this is again something that needs to be addressed. Because again, this is the procedure, as you can see in the upper part of the slide. If you want to become a specialist, you can, if you go for the master degree or the Egyptian fellowship or the MRCOG or FRCOG, as you can see, there's no difference between MRCOG or FRCOG or German FACHARTS or French diploma, as you can see here. You become a specialist immediately. If you go for Egyptian diploma, as said, you become assistant specialist, and after 3 years you become a specialist. This is for a specialist. But in order to become consultant, the lower part of the slide, consultant or senior consultant, consultant A. Then if you get a doctorate degree or American board, you become a consultant immediately. If you do Egyptian fellowship, as said, you become consultant after 4 years. If you do the FACHARTS, the DS, DOS, FRCOG, or a master degree from Egypt, you become consultant after 7 years. And then, of course, after 5 years, you become consultant, senior consultant. So there's always 5 years between consultant and consultant A. And if you do MRCOG, as said, you have to wait 10 years to become consultant, and then another 5 years to become consultant A. And if you just go for a diploma, well, you become consultant after 15 years, but you never become really a senior consultant. So the accreditation really is based on the degree, not on the training or the substantiated training. Another problem is that there is no continuous medical education or professional development required for extending the license. So you get a license for life, and there is no need to do these things to renew the license. There has been a lot of talk for the past 10 or 15 years that we need to introduce CPD. However, so far this law has not been enacted or actually issued. So the challenges, well, based on what I already said, now a large number of graduates, lack of training facilities, low salaries. Doctors in Egypt take a very low salary, which is another reason why they leave the country. There was poor in-hospital accommodation for residents. There's also the violence against doctors in outpatient departments, and inflammatory comments by some officials can lead to this, as one of the senior officials during the corona virus pandemic some doctors did not go to they blamed the bad results on doctors not going to hospitals. And so violence against doctor is actually a problem which is present every now and then. Members of the public can attack doctors in outpatient departments. There's also an education problem because patients in Egypt, if there is a complication, there's no body like the British Medical Council where people go to. No, they go to the public prosecutor. And the public prosecutor goes to the experts of the Ministry of Justice, who are usually young doctors who are not very specialized in every subject. So what can happen is that they can put the doctor under arrest until the situation is clear. So even 24 hours or 48 hours of arresting a doctor in the police post or similar is really a very traumatic experience for any young doctor. And after this, yes, the doctor can call in when he goes to court, he can call for a committee of experts to look at his case. But of course, after having been humiliated and his reputation very much negatively affected. We have the story of a doctor who was jailed for 2 years for having a total complete perineal tear done. And this is what has happened. It was a case which has to be reminded. The media also sometimes is very hostile to the doctors, and they keep talking about whenever there's a problem, which can be a complication which can happen to any patient, they go to the media, the patient goes to the media, and then the media takes it from there, and then there's no control on what the media can say or do about the doctor or how the doctor can defend himself against media. There's also uncontrolled medical and healthcare advertisement. Doctors can advertise on billboards in the streets. They can buy television time, even in official government television, and they can claim things that are simply not true, that they're the best in this operation or that operation or whatever. Because there is no controlling body to organize training and accreditation, as said, like the British Medical Council or similar councils, which should address also the medical-legal litigation problems. And with all this, there's a brain drainage, which means the immigration of the best young Egyptian medical graduates, not the Egyptian medical graduates, but the best of them. And finally, let's offer some suggestions. Now, there are attempts at correcting defects. The training has been streamlined with the rest of the world to be an undergraduate study for 5 years, followed by 2 years of housemanship in order to increase the training opportunities for medical doctors. But with these large numbers, we don't know how this can be done. Medical schools like Cairo University or Alexandria University or Ain Shams University, for that matter, can be forced to take 1,000 and sometimes 1,500 students per year, which means that they will never be properly trained. Now, there is a law which has been issued for the establishment of an Egyptian Medical Council, which is headed by the Prime Minister, and the members include the Minister of Defense, the Minister of Interior, the Minister of Finance, and of course, number 4 or number 5 was the Minister of Health. There is also an attempt to establish a national exam after senior officer training. After finishing housemanship, everybody will sit an exam and before starting practicing. And there are attempts at unifying training, but we'll still have to wait for what will emerge. And of course, there is also attempts at creating a national vocational certificate, as said, like the Egyptian board, and encouraging people to go for the Egyptian board. However, its standing with international degrees has not been finalized yet. Therefore, how should we face these challenges? We need to establish a controlling body composed of respected senior medical experts, something equivalent to the Royal College of Obstetrics and Gynaecology, which we can call the Egyptian College of Obstetrics and Gynaecology, or even an Egyptian College of Physicians and Surgeons, of which Obstetrics and Gynaecology can be a branch. We need to unify national degrees and to start talking about one degree and properly evaluate it against foreign degrees. We can never accept that the MRCG will be equivalent of a diploma because the authorities do not know that there is a DRCOG, there is a diploma of obstetrics and gynecology issued by the college, then there is the MRCG. This needs to be explained to the authorities, which is unfortunately very difficult to reach the decision-making people. We're still trying. Accreditation should be based on training rather than a theoretical degree, because people can obtain a master's degree without actually touching a patient, and this is a serious defect. We need to regulate training in hospitals by introducing training supervisors and logbooks and insisting on this and making part of the accreditation process. We need to establish and regulate subspecialist training. We need to introduce continuous medical education, continuous professional development, regulations for renewal of license. We need to issue this law. And then we should also introduce a law against violence against doctors. As you see on the right side, this was already introduced in Sudan 4 or 5 years ago, because people started to attack doctors in medical facilities, and then the law was enforced that whoever does this will be severely punished. We need to address the education problems facing obstetricians and gynecologists. We need to have a body which we are suggesting that will deal with these medical complications, and then if the doctor is negligent, of course, the body can send him to the public prosecutor. We need also to address the hostile media campaigns and establish a system of dealing with this. We need also to control the media and healthcare advertisement. As you can see on the right side, this is how a street in Cairo looks like, with all these signposts for doctors of different specialties. We need to increase the expenditure on medical training, because the budget of the Ministry of Higher Education, a good part of it goes to the university hospitals, and a good part of it is spent on buying equipment and treatment for the patients rather than on medical training. We need to increase salaries of doctors to make it equivalent to other strata of the community after so many years of working, and we need to compensate them for extra work done and overtime. We need to improve in-hospital accommodation for residents in order to ask them to stay overnight in hospitals. And then we need to improve national training standards rather than lowering the standing of recognized international degrees. Because the total health expenditure also, this is in the MENA region. As you can see, some countries spend a lot of money, and in Egypt, the money spent on each person per capita is less than 106 US dollars per year. And this is how the health expenditure per GDP in the MENA region looks like. The WHO recommends it to be between 6 and 7%. Countries like UK is about 11%, in France about 14%, United States between 15 and 16% of the GDP goes for healthcare. In Lebanon, 8.6, and as you can see, Israel 7.5. However, in Egypt, it's only 4.7, and it needs to be increased. We recognize that the MENA region contains many countries. Some of them are low-income countries, low middle, upper middle, and high-income countries. And Egypt, of course, is one of the low-middle countries. What we can do in our representative committee is that we try our best to do the training, to give people training opportunities, and we run these courses on different sorts of, these are just examples, for example, operative vaginal delivery, which is a gap. Another one is on postpartum hemorrhage. These are very popular courses that we try and do them as much as we can with the little equipment that we have to help our young doctors. And in conclusions, ladies and gentlemen, despite its strong roots, medical training in Egypt in obstetrics and gynecology faces many gaps, many challenges. Many gaps in the training procedure need to be addressed. The accreditation process needs to be simplified. CME and CPD should be introduced to new licensing. The medical legal procedures need to be reformed. There exists a need for establishing a body of senior experts to address these issues. More resources need to be injected into the system, because failing this, the best young medical doctors will continue to immigrate, and the young generation will refrain from joining the medical profession. With this, I come to the end of my presentation, and I would like to thank you very much for your attention.